It was so subtle, but it was so problematic in terms of what Dr. Fairburn just did that a real psychiatrist would absolutely never do. And she did it constantly without any kind of remorse or any kind of care. This is insane, what we are seeing. This psychiatrist, she needs to be stopped immediately. I'm just truly in shock by what I'm seeing right now. If you haven't guessed it yet, my rating of her. Hi everybody, for those that don't know me, my name is Sabrina. I'm a clinical psychologist, and on this channel I talk about psychology as we see it in various Netflix series and films. Today we will be talking about the series Wednesday that just recently came out with its newest season, and specifically I'll be talking about Dr. Fairburn and her various interactions with different patients that we see throughout the first few episodes that have been released on Wednesday. Now, if you're wanting to watch the show and you haven't yet, I would advise not to watch this video. Dr. Fairburn, from looking online, seeing that she's in the second, third, and fourth episode, so if you have not watched all of it, there will likely be some spoilers in this, and so encouraging you not to watch this if you still want to watch the series. Now, I did a different video on season 1 in which I reviewed Dr. Kinbit and her therapy with Wednesday, and I'd say that I'd probably give her a D, maybe a D+. There were some redeeming qualities, but overall the therapy was pretty bad. So if you're interested in that, you can go watch that video. But I'm curious to see how Dr. Fairburn stacks up. The bar is set pretty low, so if she gets worse than a D+, then it has to be pretty bad. But without further ado, let's jump right in.
I granted your request with the court weeks ago, so I knew you'd show your face sooner or later.
Okay, so I want to stop and talk about the visitation piece here. So Dr. Fairburn was just mentioning that she had to approve a court order for Wednesday to go there. And I want to say in psychiatric units in general, they can have visitors. They don't need to have some kind of court order for people to go there. There might be certain restrictions on things that they can do, but they are allowed visitors. However, in this case, it is a little bit different because Tyler is a convicted criminal. You know, he did off several people, and so he's being held in this unit kind of as a prisoner, basically. And that can happen. So in prisons, in jails, there are specific mental health psychiatric units, but if a prisoner is deemed to need a higher level of care, they can be transferred to a state hospital. And so mixed amongst people that might not have committed any crimes might be admitted to a psychiatric unit for another reason, which is kind of, from my understanding, what's going on here. I don't believe Willow Hill is just for people who have committed crimes. It's just general a psychiatric unit. So some people that are in this unit have not committed any violent crimes like Tyler has. Now, depending, you might need a court order if for some reason or another this person has been restricted access to visitation. Now, anybody on a psychiatric unit, it's possible that they can get restricted access to visitors if it's deemed that it would be clinically indicated. So if for some reason that person might be way too dangerous to have others, or if they're at a place where they're too mentally unstable so they can't really have visitors, if having a visitor would somehow really impact them negatively in terms of their mental health. And so there are reasons why a person can be restricted for visitors. It seems like that's the case for Tyler, that he has been restricted. And so depending on what state you're in, depending on their law, it could be that yes, you might need the court's approval to be able to actually go and visit them. So we're seeing in this scenario that's not 100% inaccurate. I can't say for sure because all states are different. So that could be something accurate that's happening. But in general, that's what's happening here. And I'm really interested to see, I imagine that I'll see soon, where Dr. Fairburn is actually leading Wednesday. Because typically in psychiatric units, when visitors actually have guests, they don't go into their rooms. They kind of go in a specific space that might be designated to see visitors, but for the most part, they're not going in this person's room. And so I'm really curious to see where they're going. And by the way, I keep looking that way because that's where my TV is. So often I'll look there and then look back at you all as I'm reacting to this in real time.
I'm guessing you chose today because of Donovan Galpin's murder. Has Tyler heard the news? Tyler has proven to be a particularly manipulative and uncooperative patient.
Okay, I want to stop here right away and just talk about the language that she's using. Incredibly judgmental. She said he's a manipulative and an uncooperative patient, that he's very difficult, basically. And although that might be true, you never want to talk about your patient that way, especially around other people, because our language shapes our thoughts. So the more that you say that, the more you're going to think that about a person, and eventually that could really impact your treatment. I mean, why in the world am I going to really want to work hard for somebody who is manipulative and uncooperative? And the reason that I'm harping on this is because she should know better. In terms of Dr. Fairburn being a psychologist, we are taught about the importance of language and how we talk about our clients. Not all disciplines are, and so there's a lot of points where maybe I'm doing interdisciplinary work and there are other people around, like nursing or pharmacists or medical doctors, that aren't really taught about this, and so might get caught up in talking about a patient in an unfavorable way. And often it's the job of the psychologist and sometimes often the psychiatrist to step in and be like, wait a minute, let's think about how we're talking about this person and rephrase that. That all of us have some kind of motive, some kind of reason that's driving our behavior. So maybe somebody is manipulative because they have a history of trauma, and so they feel like they can't really trust people, and so it might be a power thing to try and manipulate in order to have that sense of power and control. Not saying that people who have trauma are particularly manipulative. That's just an example. Yeah, so I really don't like that because, especially as the psychiatrist, she should be the one correcting any language maybe that Wednesday should be using that's unfavorable to Tyler in some kind of light.
What about Marilyn Thornhill? She still denies that she's Tyler's master. I'm working off the theory that the longer they're separated, the weaker their bond becomes.
Then I surmise the only reason you and I are speaking is because you need my help.
My traditional care methods aren't yielding results, so I think it's time to be unorthodox.
All right. Dr. Fairburn is really not starting out well at all. So she made this comment about her typical methods aren't working, so it's time to be unorthodox, and Wednesday senses that she's there to get her help. And from my understanding, if I remember correctly, and in season 2 it opens a lot talking about, over the summer that the school year had ended and now they're back. So now they're back in the fall, I guess. And typically the summer would be around 2 to 3 months. And yes, when it comes to a course of therapy, if something hasn't been working for 2 to 3 months, you definitely want to change course. You definitely want to figure out what's been going on, because around that period of time, honestly, around that period of time, a lot of therapies might even be completely finished and you would expect good results. So if you're not seeing any kind of change around that time, then you do want to do something different. That doesn't necessarily mean it needs to be extremely radical. You have not gotten to the point after 2 to 3 months where you've probably exhausted all therapeutic options that now you need to do something completely different and unheard of. It's just been a few weeks. So yes, I'd agree that you want to do something different in therapy, but you definitely wouldn't want to enlist the help of a teenager. A teenager that is not a mental health professional and should not even be hearing the details of what's been going on in terms of treatment. At this stage, when things aren't working, and if you do truly feel stuck with somebody, that could be the case, especially if they are, more difficult or complex in nature, then there's a lot of things you can do before going unorthodox and enlisting the help of a child effectively. Those things can be consulting with other mental health professionals that might work with similar patients and can give you new insights, because we all have different perspectives. And so consulting is a huge one, that getting some kind of peer supervision, or in our field, you can even pay somebody, like you can pay an expert, say an expert in a certain treatment, you can pay them to be able to have supervision with them. So that is an option that typically in this situation I would go for, and a lot of us mental health professionals would go for. And then also looking at research to see what might the research say about treating somebody that has the same presentation. Maybe it's going to certain conferences where you can hear more and learn more about it, or there's different types of listservs, so for the different niches that you might be in, and so for people who work, say, in psychiatric units, and it probably even gets more specific From there, you can have a listserv where it has a group of mental health professionals that work in that setting. So again, this is like supervision, but could be from supervision from people that you don't necessarily know that might have better experience, and it can be paid and unpaid to get a better idea. So all of that I would have done before enlisting, well, I would have never enlisted the help of a child that is not a mental health professional, but we see Dr. Fairburn doesn't do any of that. She kind of throws in the towel pretty quickly, saying, oh, he's manipulative, he's difficult, I'm not going to be able to figure it out. And another thing I'm really curious about that maybe they'll talk about a little bit later, like I don't know if Dr. Fairburn's going to sit down with Tyler, if they're actually going to show us a session of them together, which would be super, super interesting to see. But another thing is making sure to be really clear about what the goals are with therapy. And the reason we want to be really clear is because that helps us figure out what kind of treatments would be appropriate. And when we think about people that are in psychiatric units generally, a lot of times the goal is symptom reduction, that they're there because their mental health symptoms have gotten to a point where maybe they cannot live safely in society or function well. So the idea might be to stabilize them, get them on medications, and be able to reduce the symptoms so that they can live better, so that they can start taking care of themselves physically, maybe not harming others, not having as much paranoia or hallucinations, etc. So that's typically for a lot of people a blanket goal, because a lot of the times when you get folks that come into psychiatric units, they might not be in touch with the reality enough, or might be so symptomatic that they can't tell you what your goals are, what their goals are, and you can't really collaborate with them. But in this case, for Tyler, who is a criminal, we don't really understand what the goal is. Like, is the goal to not get him to transform into a Hyde anymore? Is the goal to not get him to be so violent? It hasn't been specified why he's really there, like what he's working on. It seems like he's just kind of there because he's a danger to society, but we don't know what he's working on. And so I can understand Dr. Fairburn feeling so confused because you don't have a clear sense of what am I doing here. So to give an example of why these goals might be important, take for instance, wanting to learn a foreign language. Say if you want to learn a foreign language because maybe you really enjoy traveling and you want to be able to go to a place and feel comfortable talking with other people and just be at a conversational level, then that is a very different goal than, say, for instance, your job requires that you see a lot of people who speak a certain language, so you want to be able to better understand what they're saying and better help them and translate. For instance, that's something that led my mom to want to learn Spanish because she's an immigration lawyer, and a lot of her clients in the area that she's in are from Spanish-speaking countries, so a lot of her clients didn't speak English, and so not knowing Spanish was a real limitation to her and her business. Versus another goal of, I want to move to another country and live there long term. All of those are very different, and the ways that you would go about getting to those goals is very different. So if you have the goal like my mom did of learning to help for work, she, yes, would focus on speaking and listening, but would also really need to focus and learn a lot very technical terms for immigration and focus a lot on writing and reading to make sure she's going over the briefs with clients and checking the things that they turn in to make sure there's no errors. Like, she would have to be very specific in that area. If you're wanting to travel, maybe you'd have to learn a lot of common phrases. So maybe you focus a lot on the speaking and listening, not as much on the reading. Maybe you just need to read enough to be able to read a menu, right? But you're not focusing and diving into the technical. Versus if you're wanting to live in a place, it's kind of everything, right? So hopefully that helped, giving that example of how the goals really, really makes a big difference in terms of figuring out the steps to get there. So I'm confused at this stage of what the goals are for Tyler in terms of his rehabilitation. So I imagine that's leading to some of the problems where Dr. Fairburn feels like she's stuck. She needs to figure out what his goals are first before doing anything else.
You could be the psychological shock Tyler needs to initiate his rehabilitation.
If the sight of me brings him any modicum of pain, count me in.
Okay, so I don't know. This seems like it was kind of a play on shock therapy, electroconvulsive therapy, which I did do a video on, by the way, which not many of you have seen, which I don't know why, because I think it's personally fascinating. But anyway, this shock to the system, and if I bring him pain, then that would be pleasurable or whatever, however Wednesday said it. Again, she's not at a stage where she even, Dr. Fairburn, where she needs to be thinking about doing something so radical. When we think of electroconvulsive therapy or shock therapy, it's often a last resort for people who are not responding to other treatments, which is generally, I think, the idea that she's having of, oh, he's not responding to other things, so Wednesday's going to be like his shock therapy. He's not at that stage yet. She hasn't exhausted all the different resources that she could to actually give him some kind of treatment that isn't so radical. So yeah, again, I just think that she's jumping the gun on this. And also, it seems like she's leading Wednesday into his room, which again, like I mentioned, you typically wouldn't do. Even with somebody that's on lockdown, you would still have a place that they would meet. So that's something that's not realistic that would happen.
Now, you'll be perfectly safe, but if you feel threatened or uncomfortable in any way, push the red button on the wall. I'll be watching everything on the monitor.
I know she is not letting a teenage girl walk into that room herself. That, okay. No. And when it comes to visitation, these wars, that you would not be alone visiting somebody. Like, they're not just going to have her go into the room, lock the door, and say, oh, we'll be close by if you need me. Even though probably I can imagine Tyler's going to be locked up in some way in that room. That would not happen. They would definitely go in with her. So this is also a fantasized image of what would be going on in real life. And maybe there'd be some considerations for letting an adult go in, but let's remember Wednesday is a child, even though she acts like, she's 40 years old, but she is a teenager, and so this happening is also just not realistic in any way, shape, or form. A child would never be sent in to visit with a psychiatric patient themselves.
And I'm here representing Tyler, who rather grimly asked me to make sure his father was really dead. What's your excuse?
I don't know if you all caught that because that was so subtle. I'm going to replay that because it was so subtle, but it was so problematic in terms of what Dr. Fairburn just did that a real psychiatrist would absolutely never do. So listen to that again.
And I'm here representing Tyler, who rather grimly asked me to make sure his father was really dead.
So the issue is, and what she kind of did in the clips before when they were going to meet Tyler, is that she is breaking his confidentiality. I mean, that is just an absolute no-no for us mental health professionals and even a lot of other professions to break people's confidentiality. And she did it in a subtle way. Her saying, oh, I'm coming because Tyler asked me to make sure that his father was really dead. That's breaking his confidentiality of specifically saying this person, my specific client, told me to do X thing. That is information she told her in confidence. There's absolutely no reason for her to share that with Wednesday. And even in the clip before, when she was talking about giving her examples of how difficult Tyler's been in therapy, that's also his confidential information. No reason that she should be sharing that with Wednesday. There are a lot of instances where we would break confidentiality in the case of serious harm, so wanting to seriously harm oneself, so wanting to die by suicide, for instance, or seriously harm another person, or abuse or neglect. But even in those instances, we are reporting to the proper reporting bodies, so people like police if needed for safety concerns, and even then it's very, very specified. So it's not just somebody saying, oh, I want to attack people. It would have to be much more specific than that. And so she is very easily giving out confidential pieces of information like it's candy. And that is such a problem. Another thing that she does that wouldn't happen in real life but happens in the show is her even attending this funeral, just because Tyler specifically asked her if she would. There are a lot of ways to assess and to make sure a person is truly deceased. So they would have their obituary, so you can look through that. They would also have like a death certificate. There's a lot of ways to find these things out that does not include physically going there. And for instance, different but pretty similar in my line of work. So I work in a drug and alcohol rehabilitation center, and a lot of times the folks that I work with, they're in some kind of relationship, and the person that they're in a relationship with might also use drugs. And so a lot of times when the person gets into the program, they might worry and maybe they don't hear from their significant other and they feel like, well, they might have overdosed on drugs. That I've had a couple people have that concern. And so we don't just offer to say, okay, hey, let's jump in a car together and let's go drive around the area and figure out if the person is okay. No, there's plenty of ways to figure out if they are not. So it would be figuring out the area that person lives in and calling to the local hospitals. If that person, say, drives a certain vehicle, you could reach out to the police and say, hey, that this vehicle is missing, or we believe this person is missing. And then, they'd be able to flag the vehicle. That way, if they find it, they could find it in relation to that person. So there are a lot of ways to figure that out. So I have never, and will never, when somebody mentions that, go to the actual place or try to physically find them myself. So this is unrealistic that this would happen.
Did Galvin ever visit Tyler?
You don't really expect me to tell you that. Once. Within seconds, Tyler transformed. Almost ripped through those titanium bars. Took a full 5 minutes with a shock collar before he returned to his human form. I've never seen anything like it. Pure, undiluted rage.
Oh my gosh, okay. I'm gonna need a moment. I'm gonna need to collect myself. This is insane, what we are saying. This psychiatrist, she needs to be stopped immediately. I cannot believe... Okay, sorry guys. I'm just truly in shock by what I'm seeing right now. I know that us mental health professionals are always just horribly portrayed. Not always, because I did my video on adolescence, and I think that she actually did a decent job portraying clinical psychologist, but this is horrendous. So Wednesday basically has her under her control, and it's super easy to just get her to give out any of this information. Like I was saying before, she's not keeping anything confidential. She just described in detail personal information of this is what happened during our session, of that, his dad came to visit him. No, 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 no. He did not authorize her to share any of that information with probably anybody, but he especially did not authorize her to share that information with Wednesday. Now, there are points where we can share information if somebody signs a release of information or an ROI saying that, yes, we can talk with this person and share certain health information. And even then, we'd want to kind of clarify what things they'd want to share and what not. Signing an ROI doesn't give them just free reign to get information on anything that happens ever. And so this would not happen. I promise, please don't be afraid to go to a psychiatrist or a therapist because you think that they're going to be blabbing your information to a teenager that they just met. Okay, but let's power through this scene. I mean, I can't imagine that it would get worse from here, but famous last words, right?
Rest assured, we have no avian patients at Willow Hill.
I appreciate your candor.
Like you said, the only reason that Tyler is safely locked away is because of you. I think that's worth a little off-the-record quid pro quo.
It is not worth a little off-the-record quid pro quo, Dr. Fairburn. Absolutely not. And the quid pro quo, what that kind of stands for is basically an exchange of something for something else. So kind of a this for that, right? So she's saying to her, okay, Wednesday, you're the reason that he's safely locked up. So for that, I think that you deserve me giving you a little bit of information. Absolutely not. Those things are not equivalent. A person's confidentiality, a patient's confidentiality in mental health treatment is not something that you just exchange. Even though, yes, it is true that Wednesday is the reason that he is, safe locked away and can receive some kind of treatment, but that doesn't mean that she deserves the reward of getting his reward, if you could even call it that, of getting his confidential information, of his rights being broken. Definitely not.
I know the suspense is killing you.